Okay, good morning po ma'am. Now po I will be going to demonstrate on how po to assessing the female genitalia and also din po the rectum. So first po muna is to gather po the equipment. So we have the light po, this tool, we have also po the speculum, we have also din po the emesis basin with warm water, we have also din po the surgical lube, and then the cotton tip applicators, and then culture tube, culturette, and then test tube, and also din po, we have also a sterile gloves, and then the aire spatula and feminine napkins. So next naman po is proceed na po tayo to the patient to explain po the procedure. So good morning po ma'am, I am Leonard Pilansa po and I will be your nurse student for today. May I know your name po? Okay, how about po your date of birth? Okay, so now po ma'am, I will be going to assess po your genital and also din po your rectum, which is very important po to know if you have presence po ba of abnormalities to this part of your body or kung wala naman po. So I will be going to touch po your vaginal part and also din po your rectum part. So it is okay po ba yun sa inyo? Okay, so next naman po natin is I will be going to hand hygiene and provide for the client privacy by closing the cording. Okay, then after po that is ask na po the patient to put pa a gown. So assume po that the patient wear na po the gown. So next naman po natin sa first physical examination, which is first po muna tayo is sa um, external genitalia po muna tayo. So first po sa external genitalia is to inspect po the mons pubis po. Okay, I will go to inspect. Okay. So, okay naman po yung mons pubis, which is okay naman po yung distribution of pubic hair, and no sign naman po of infestation. Next naman po natin is to inspect po the labia majora and also din po the perineum po. Okay, inspect. Okay, no excoriation naman po, no swelling naman po, and lesions. Next naman po natin is to inspect naman po na the labia minora po and clitoris, and also din po the urethral meatus, and also po the vaginal opening. So I will be going to insert po. Okay. Okay, so no swelling din po, no lesion, and also din po no excoriation and discharge po. Next naman po natin is to palpate na po for Bartholin glands. So noting po for the swelling, tenderness, and also po discharge. Okay, so I will be going to put po sterile gloves. Okay. Okay, so I will be going to palpate na po the Bartholin glands by pinching po the labia majora po. So I will going to use po my index finger and thumb. Okay, okay, then this other side po. Okay, okay. So no swelling naman po, and also no tenderness and discharge. Next naman po natin is to palpate na din po for the urethra po. So by inserting po the index finger to the posterior portion po of the vagina, and then milking the urethra po inside, then pushing out up po and out, pushing up and out po, and observe po for the drainage. Okay, okay. So no drainage naman po nangyari. Next naman po natin is punta na po tayo to the internal genitalia. So sa internal genitalia po, first is to inspect po natin the um, the size po of the vaginal opening and also din po the angle po of vagina. So by inserting po the index finger, I will go to moist po here with warm water. Okay. So I will go to insert po. Okay. 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 So okay naman po yung size and also din po ng angle po of the vagina. Next naman po natin is to assess na po the vaginal musculature po. So I will be going to use po of my index finger and middle finger. So I will be going to insert po to the vaginal opening. So I will be going to insert only po my index finger and then asking the patient po to squeeze around my finger po. So can you squeeze ma'am around po my finger? Okay. So, next naman po, I will be going to use po of my index finger and then the middle finger to separate po the labia minora po. And then asking po the patient to bear down. Okay. So, can you bear down po, ma'am? Okay. Okay. So, um, no bulges naman po and also discharge of urine. Next naman po natin is perform na po tayo of um, speculum examination. So, assume po that this is the speculum. So, I will be going to insert po to the vagina and then open. Okay. Then, first po muna is to inspect po the cervix. Inspect po the cervix. Cervix po for the color, size, position, surface, and OS, discharge, and lesion. Okay. So, okay naman po yung cervix. Normal naman po. Next naman po natin is to obtain na po of specimen of the pap smear if indicated po culture to test STDs. Okay. After po that is inspect na po natin the vagina po. So, I will be going to unlock na po the speculum and then slowly rotated po and remove. And then, note po for the color, okay, color, surface, for the consistency and discharge. So, okay naman po yung color, yung surface and consistency and no discharge naman po. Next naman po natin is proceed na po tayo to the to perform na po of by manual palpation. So I will be going to use po of my placing my non-dominant hand to the lower abdomen and then by inserting po my glove lubricated index finger and middle finger to the vaginal opening. Okay, I will be going to insert and then applying pressure po to the posterior wall. Okay, so applying po the posterior wall and waiting po to opening to relax po. Okay. After po that is to palpate na din po for ovaries. So by sliding po the intravaginal finger po into the right lateral fornix, then attempt po to palpate for the left and right ovaries. I will be going to palpate po for the right and left ovaries. Okay. Okay. So okay naman po yung size, yung shape po is okay naman po. And also din po the mobility, the consistency um and then the tenderness po. So after withdrawing po my finger is no secretion naman pong nangyari. Okay? Next naman po natin is to palpate na po natin for the recto-vaginal examination or perform na po of recto-vaginal examination. So I will be going to change po the gloves po to my dominant hand. Okay, then changing po. Okay, after changing po. Okay. And then inserting na po my lubricated index finger to the vaginal opening and okay, to the vaginal opening, and also din po the middle finger to the rectum po. Okay? So, while pushing po down the abdominal wall. And then, okay, after po that is palpate na po for the internal reproductive structure po. Okay, so okay po, after palpating po is okay naman po yung rectovaginal septum, and also din po yung cul-de-sac, and also din po yung posterior uterine wall. So, normal naman po. So, next naman po natin is proceed na po tayo to the examination na po of the anal and perianal area. So, okay. So first po is to inspect po for the lumps, lesion, and also din po for the ulcers, rashes, and redness. Okay? Using po the same position of the patient. Okay? So, okay naman po siya. Next naman po natin is to inspect po the sacrococcygeal po area for the swelling, redness, dimpling, and presence po of hair in pyramidal area. Okay, well, inspect it po. Okay. Next naman po natin is to inspect din po the rectal prolapse with Valsalva maneuver. So, okay. So, can you bear down po, sir? Okay. Okay, so okay naman po. No lesions and discharge naman po. Next naman po natin is to palpate na po for the anal sphincter for the tone and tenderness, nodules, and hardness. Okay, so I will be going to put po my index finger. Okay, I'm waiting for to relax the opening. Okay, so okay naman po. Next naman po natin is proceed na po tayo to the rectum naman po. So sa rectum po, first po is to palpate po the rectal mucosa po for the tenderness, irregularities, nodules, and hardness. So I will be going to insert po my index finger, and then counterclockwise and clockwise motion. Okay, okay, and then okay, after po that is palpate na din po natin for the peritoneal cavity. So for the tenderness, nodules, and then or for the rectal shaft. We're going to okay. Okay, then okay naman po siya yung peritoneal cavity. Next naman po natin is to after po withdrawing the index finger is inspect na po for the phases of blood and perform occult blood test. But this tool po is have no free from blood naman po, which is normal naman po. So that's all po ma'am for the demonstration po. So thank you po ma'am for your cooperation. All information lang po that I've gathered will be direct po to the doctor. So after po that ma'am is analysis na po of data, which is first po is formulating of nursing diagnosis. And next po is formulating of collaborative problems and make necessary referrals. So that's all po ma'am for the demonstration of the assessing of female genitalia and also din po the rectum. So thank you po.